The following segment is sponsored by Oakview Medical Associates.
As you admire all the beautiful blooms of spring, your allergies may be in bloom as well. And for some people, it started happening earlier than normal this year. Dr. Nita Bijoor is here from Oakview Medical Associates to talk about it. Hi, Dr. Nita.
Hi, Margaret. How are you?
Good. It's good to see you.
You too.
Allergy sufferers, they're dealing with the sneezing and the runny nose and the watery eyes, the ear congestion. What are you seeing among your patients, especially this year?
We are seeing a pretty significant allergy season this year. I think that's partly because we had a milder winter, so we have longer growth times for the trees and grasses. So the pollen counts have been high starting January, and we're anyway in the allergy capital of the U.S., so we really have to get a head start, plan early. We're seeing a lot of sufferers with headache, fatigue, just nasal congestion, like you said, scratchy throat. And it's time to do something about it.
Yeah, so getting into some of those tips then to minimize the suffering.
Yeah.
Pollen is a major allergen triggering thing, and those symptoms. The first thing that you wanted to tell us about was housekeeping. That can make a real impact.
Big impact. So making sure, you know, if you have, these are long-term goals, but getting rid of carpet or casing your bed covers, allergy-proof bed covers. So there are a lot of things you can do to avoid the pollen. There's 3 different triggers right now. So in the spring, it's tree pollen. In the summer, it's grass pollen. And then fall, it's ragweed. But trying to minimize exposure is really important at this point in time.
Yeah, and minimizing exposure is as simple as maybe not opening those windows and letting in the fresh air. People love to do that, but that's inviting in those allergens.
Yeah, so the highest pollen count is in the morning. So trying to keep your doors shut or the windows closed, that's important. If you go outdoors wearing a mask, you know, using a cover. And then something we don't talk about, my favorite is nasal saline. I can't tell you how important that is. Even for my kids, if they come with the slightest sniffle, I squirt that nasal saline, and it just clears them up and prevents a sinus infection. Salt is a very good disinfectant, so it works really well. Nasal steroids is another big one to start using. Antihistamines, you know, we all know about the antihistamines. There's also another one called anti-leukotrienes, which is Montelukast is the generic name. So talk to your doctors and really find out what's the best fit for you, what works well, because there are a lot of options now for treatment.
Yeah, and just being able to flush it out is a great thing.
It's the best thing.
Some people use a dehumidifier to reduce excess moisture. What does that help with? What kind of difference does it make?
Yeah, so when you're allergic to mold and fungi, so that is, it thrives on moisture. So if you use a dehumidifier, you're going to get rid of the mold in the air, and so that helps with that a lot.
And you said, you know, you're thinking about the time outdoors. Morning time is the worst, so you don't want to, you know, for the sake of your allergies, do all your outdoor activity in the morning. Any other recommendations to keep in mind?
I think this year specifically, because it's been very severe, you know, we've been at home for 2 years and now everyone's getting out, so we've not really built up our memory cells towards allergens. So everyone has a heightened response. Just planning ahead is the most important tool, taking your meds with you. It's not just important to treat the allergies, but to control it and to prevent it. And it's still early. We still have April, May, June, so plan for that. Talk to your doctor. That's another one.
And if it's bothering you, it's worth that conversation. It is important to get with the doctor and talk to Oakview Medical Associates. You can diagnose and treat their symptoms. Talk to us a little bit about your practice and what makes it so unique.
So ours is a primary care practice in the Five Forks area of Simpsonville. We are we focus on the entire health for the patient. So we see all ages from newborn to 100 and up. We take care of sick patients, but we also take care of their preventive health aspects. So getting them from sickness to wellness, whether it's they're struggling with weight, mental health issues. We have all the resources. We have lab on site. We have imaging, diagnostics. So we have aesthetics. So we do a lot of things that go above and beyond for our patients. That's what we're here for, to serve.
Yeah, and people love working with you. You're located at 11 Five Forks Plaza Court in Simpsonville. The number 627-0444. People can get a hold of you that way. Dr. Nita Bijoor from Oakview Medical Associates, thank you so much for being here.
You're welcome. Thank you.
Now.